Picture this. It's late at night. The house is quiet. And suddenly, you feel a strange pressure in your chest. Not sharp, not stabbing, just heavy. You pause. You wait. You tell yourself, maybe it's nothing. But what if that nothing is the moment that decides everything? And here's the truth most people don't want to hear. Many seniors don't recognize a heart attack until it's too late, not because they're careless, but because the symptoms don't always look like what you expect. Listen carefully. This could save your life. Welcome to Dr. Danzy's Senior Health Tips. I'm Dr. Danzy, and today I'm going to walk you through something that could protect you, even if you're completely alone. But I'm not just going to tell you what to do. I'm going to show you what most people get wrong, and the one mistake that turns a survivable moment into a tragedy. Now let me ask you something. Have you ever felt a strange tightness in your chest and ignored it? Or maybe a sudden wave of fatigue out of nowhere? Does this happen to you? Because here's the problem. Heart attacks don't always start with dramatic pain. Sometimes they whisper first, and that's where the danger begins. One man told me he felt just a little pressure. Nothing severe. He went to bed, thinking it would pass. He didn't want to overreact. But that night, his condition worsened silently, because what he felt wasn't just discomfort. It was his heart struggling for oxygen. I'm not trying to scare you, but you should know this. Your body gives warning signs. The question is, will you recognize them in time? Now listen, this is important. Most people think a heart attack means sudden crushing chest pain, like in movies. But in reality, especially for people over 60, it can look very different. It can feel like a strange pressure, not pain, a burning sensation, like indigestion, a tightness that comes and goes, or even no chest pain at all. Yes, you heard that right. Some seniors have a heart attack without any chest pain. Instead, they feel something else. Shortness of breath, even while sitting, sudden sweating, cold, sticky sweat, nausea, like something is wrong in your stomach, or a deep, unexplained fatigue. Have you noticed this before? Because many people ignore these signs. They say, I just didn't sleep well. Maybe I ate something bad. I'll wait and see. And that waiting is where lives are lost. Now here's something most people don't realize. Your heart doesn't fail all at once. It struggles first. It sends signals, small ones, confusing ones. And if you miss them, the situation can turn critical very fast. Let me explain it simply. Your heart needs oxygen to survive. It gets that oxygen through blood flow. But during a heart attack, that blood flow gets blocked, not partially, sometimes completely. And when that happens, your heart muscle starts to die, minute by minute. Listen carefully. Time is not just important. Time is everything. Now imagine this. You're alone. No one is around. Your phone is across the room. You feel that pressure again. What would you do? Would you wait? Would you try to sleep it off? Or would you act immediately? This is where most people hesitate, and hesitation is dangerous. One woman told me she felt extreme fatigue, like her body was shutting down. No chest pain, just weakness. She thought, maybe I'm just tired. But inside, her heart was in trouble. By the time she got help, the damage had already started. That's why you must understand this. A heart attack doesn't always scream. Sometimes it whispers. And if you ignore that whisper, it becomes a crisis. Now here's another mistake, and this one shocks people. Many seniors think, if it's serious, it will get worse quickly. But that's not always true. Sometimes symptoms come, then fade, then come back stronger. That doesn't mean you're safe. That means the blockage is building. Don't miss this. Your body is giving you a second chance, but many people waste it. They wait for clear proof. They wait for real pain. They wait until it's too late. Now I want you to think about your daily life. Do you ever feel unusual tiredness in the morning? A strange heaviness after walking a short distance? Mild chest discomfort that comes and goes? Does this happen to you? because these could be early warning signs, and the earlier you recognize them, the better your chances. Now I'm going to tell you something very important. There is a moment, a small window of time, where your actions can save your life, or cost it, and most people don't even realize when that moment begins. Because what you do in the first few minutes changes everything. In the next part, I'm going to show you exactly what to do, step by step, when you feel those symptoms, and you are completely alone. And also, one dangerous myth that many people believe that can make things worse instead of better, because what you've heard before might not be true. Now imagine this moment again. You feel that pressure. Your breathing feels off. Something inside you says, "This isn't normal. This is it." This is the moment where your next decision matters more than anything. Listen carefully. Don't miss this. The first thing you must do is not wait, not sit quietly, not see if it passes. You act immediately. Call 911, not your neighbor, not your family first. Emergency services. Because here's the truth most people ignore. Paramedics don't just transport you. They start treatment the moment they arrive. That can save your heart before you even reach the hospital. Now you might be thinking, what if I'm wrong? Good, call anyway. It is always better to be wrong than to be late. I'm not trying to scare you, but you should know this. Half of heart attack deaths happen within the first hour. That's how fast things can turn. Now let's talk about something very important. Should you drive yourself? No, never. Even if you feel okay. Because during a heart attack, your condition can change suddenly. You can lose consciousness, you can lose control, and now it's not just your life at risk, but others on the road. One man thought he could make it to the hospital himself. He said, "It's only 10 minutes away." But halfway there, he became dizzy, his vision blurred. He barely managed to stop the car. That decision almost cost him his life. Don't make that mistake. Call for help now. While you are waiting, this is where most people panic. But listen carefully. Panic puts more strain on your heart, and your heart is already struggling. So here's what you do. Sit down, not flat on the floor, not walking around. Sit with your back supported, head slightly raised. This position helps your heart work easier. Now breathe slow, controlled, in through your nose, out through your mouth, even if it feels hard. This is important because your body is fighting for oxygen, and controlled breathing helps reduce that stress. Now here's a simple but powerful step. If you have aspirin and you are not allergic, chew it. Don't swallow whole, chew it. Why? Because it works faster that way. Aspirin helps thin the blood, and during a heart attack, that can help slow the clot that's blocking your artery. But listen carefully, only if you already have it. Do not waste time looking for it. Time matters more. Now I need to clear up a dangerous myth. You may have heard this before. Cough hard, and it can save your life. No, this is false. Let me explain simply. Coughing does not unblock an artery. A heart attack is a blockage problem, not a breathing problem, so coughing will not fix it. In fact, wasting time doing that can delay real help. Don't fall for it. Now here's another mistake people make. They take random medicines, leftover pills, strong drugs they don't understand. Listen carefully. This can make things worse. Some medications can drop your blood pressure too fast, and during a heart attack, that can be dangerous. So keep it simple. Call 911, sit down, stay calm, take aspirin if available. That's it. Now here's something most people don't think about. Your home. Yes, your home. If help is coming, make it easier for them to reach you. Unlock your door. If you have pets, put them in another room. Keep your phone close. These small steps save precious seconds, and seconds matter. Now let me ask you something. Have you ever felt symptoms and hesitated to call for help? Maybe you thought, I don't want to bother anyone. What if it's nothing? Listen carefully. Your life is never a bother. Never. Now here's another important moment. What if you feel slightly better? Should you cancel help? No, never. Because symptoms can fade while the damage continues. That's the scary part. Your body may feel calm, but your heart is still in danger. One woman felt chest discomfort. Then it eased. She thought, I'm fine now. But hours later, the pain came back stronger because the problem was never gone. Don't ignore temporary relief. Now, I want you to remember this one line. Time is muscle. Every minute you wait, more heart muscle is lost. And once it's gone, it doesn't come back. This is why fast action matters. Not later, not after rest, now. But here's where things get even more important. What if someone else is with you? What if they collapse? What if they stop responding? Most people freeze in that moment. They panic. They don't know what to do. And those few seconds become the difference between life and death. In the next part, I'm going to show you exactly what to do. If someone goes unconscious in front of you, how to act, how to help, and how to keep them alive until help arrives. Because knowing how to save yourself is powerful, but knowing how to save someone else, that changes everything. Now imagine this. You're not the one in pain anymore. Someone near you suddenly collapses. Maybe it's your spouse, maybe a friend, maybe someone right in front of you. They were just talking, and now they're not responding. This is where most people freeze. Their mind goes blank. Their body hesitates. But listen carefully. This is the moment where you become the difference. This is important. First, check them. Are they awake? Call out to them. Tap their shoulder. No response? Now look closely. Are they breathing? Not shallow? Not gasping? Normal breathing. If the answer is no, you are not waiting anymore. Call 911 immediately. Put the phone on speaker. Do not hang up. Let them guide you. Now listen carefully. Don't miss this. You are about to do something that can save a life. Place the person flat on their back. Kneel beside them. Put one hand on the center of their chest, right between the nipples. Place your other hand on top. Lock your arms straight and push, hard, fast, about 100 to 120 times per minute. That's about the rhythm of a steady beat. Push deep. Let the chest come back up. Then push again. Do not stop, even if you feel tired, even if you feel unsure, because something is better than nothing. And this is everything. I'm not trying to overwhelm you, but you should know this. When the heart stops, every second without action reduces survival. This is called cardiac arrest, and it can happen during a heart attack. Now here's something powerful. Even if you've never done this before, even if you're scared, your action can keep blood flowing to the brain. You are buying time. Time until help arrives. Time until a machine can restart the heart. Now listen, if there's an AED nearby, a defibrillator, use it. Many public places have them. They give simple voice instructions. You don't need to be an expert. You just follow the steps. But here's the truth. Most people don't act, not because they don't care, but because they're afraid of doing it wrong. Listen carefully. Doing something imperfectly is far better than doing nothing perfectly. Now let's come back to you, because this is where it all connects. Most heart attacks don't start with collapse. They start with signs, warnings, signals your body sends before things get critical. And if you catch them early, you may never reach that emergency moment. So let me ask you again, have you ever felt a strange pressure in your chest, sudden sweating without reason, unusual fatigue that doesn't make sense? Have you noticed this? Because these are not random. These are signals. Now here's where many seniors make a quiet mistake. They normalize discomfort. They say, I'm getting older. This is just part of life. But listen carefully. Not everything is just aging. Some things are warnings, and the sooner you respect those warnings, the more control you have over your future. Now I want to share something simple, but powerful. Start paying attention to patterns, not just one moment, but repeated signs. If something happens again and again, your body is trying to tell you something. Don't ignore it. Now here's a small step you can start tonight. Keep your phone close when you sleep, always. Not in another room, not far away, because emergencies don't wait for convenience. They happen when you least expect them, and one small action can save your life. Also, memorize this. Emergency number 911. Sounds simple, but in panic, people forget. Now here's something else. Talk to your family. Yes, this matters. Let them know what symptoms to watch for, what medications you take, where your important details are. Because in an emergency, clarity saves time, and time saves life. Now let me tell you something honestly. I'm not trying to scare you. But heart attacks don't give long warnings. They give short windows. And what you do in that window changes everything. Some people survive because they act. Others don't because they wait. So the question is, which one will you be? Because now you know the signs, you know the steps, you know what matters. And that knowledge is powerful. In the final part, I'm going to show you how to reduce your risk, how to protect your heart before anything happens, and the daily habits that quietly increase your danger. Because survival is important, but prevention, that's where real control begins. Now listen carefully. Everything you've learned so far can save your life in an emergency. But here's the truth most people ignore. The real power is not just surviving a heart attack, it's preventing it from ever happening. Because once damage starts, you can't undo it completely. But before that moment, you have control. And most seniors don't realize. The danger builds slowly, silently, every single day. Let me ask you something. Do you sit for long hours without moving? Do you feel tired even after small activities? Do you rely on quick meals, sugary snacks, or too much salt? Does this sound familiar? Because these are not small habits. These are slow triggers. One man told me, "I don't smoke, I don't drink, I thought I was safe." But he sat for hours daily, barely moved, ate whatever was easy. His risk wasn't obvious, but it was building, quietly. Now listen, this is important. Your heart is a muscle, and like any muscle, if you don't use it properly, it weakens. You don't need intense workouts. Start simple, even 10 minutes of walking, twice a day. Yes, just that. It improves blood flow, reduces pressure, strengthens your heart. Start with this tonight. After dinner, walk slowly for 10 minutes. No excuses. Now here's another silent danger. Food. Not just what you eat, but what you eat every day. Too much salt raises blood pressure. Too much sugar damages blood vessels. Too many processed foods clog your arteries. And the scary part? You don't feel it happening. Until one day, you do. One woman thought her diet was normal, but her meals were high in salt and packaged foods. Over time, her blood pressure rose. She didn't notice until she started feeling chest tightness. That was her warning. Don't wait for yours. Now listen carefully. Add more real foods, fruits, vegetables, simple home-cooked meals. You don't need perfection. You need consistency. Now here's something many people overlook. Sleep. Yes, sleep. Poor sleep increases stress hormones, raises blood pressure, strains your heart. If you wake up tired or sleep less than 6 hours, your heart feels that every night. Start with this. Turn off screens earlier. Create a calm routine. Your heart recovers while you sleep. Now let's talk about stress, because this one is dangerous and invisible. Worry, anxiety, overthinking. They don't just affect your mind, they affect your heart. Stress tightens blood vessels, raises heart rate, pushes your system constantly, and over time, that pressure adds up. Listen, I'm not saying remove stress completely. That's not realistic, but you can manage it. Simple steps. Deep breathing for 2 minutes. Quiet time. Talking to someone you trust. Small actions, big impact. Now here's another question. Do you check your health regularly? Blood pressure, blood sugar, cholesterol, or do you wait until something feels wrong? Because waiting is risky. Many heart attacks happen in people who felt fine. Regular checkups give you early warning, and early warning gives you power. Now listen carefully. There's one more thing most people don't want to hear. Smoking. If you smoke, even occasionally, your risk increases immediately. Every cigarette damages blood vessels, reduces oxygen, strains your heart. But here's the good news. The moment you stop, your body starts healing. It's never too late. Now I want you to pause for a second. Think about your daily routine, your habits, your choices. Are they protecting your heart or slowly hurting it? Because the small things you do every day decide your future. Not one big action, but repeated small ones. Now let me tell you something honestly. I'm not trying to scare you, but I've seen too many people ignore simple warnings. Too many people think, it won't happen to me, until it does. But you are different now. You are informed. You are aware. And that changes everything. Now I want to hear from you. Where are you watching from? How old are you? Do you live alone or with family? And tell me honestly, have you ever felt any of these symptoms before? Comment below. Your story could help someone else. And if this video made you think, even for a moment, share it with your family, with your friends, because one piece of information at the right time can save a life. This is Dr. Danzy from Dr. Danzy Senior Health Tips. And remember, your heart is not just an organ. It's your life. Take care of it. I'll see you in the next video.